86-year-old female with shoulder pain going on for at least a year. She fell at that time and thinks that may have triggered it, but she didn't really notice a whole lot of pain after the fall. She was told she has severe arthritis in the shoulder. She had a couple of cortisone injections over the past year, which do give her about 5 months of relief. She's interested in continuing with an injection, but not cortisone. But she never really she didn't have an MRI of the shoulder, so we're going to go ahead today and just do a ultrasound just to kind of see what we're dealing with. Here we're going to look at the biceps tendon in short axis. Here you can see the biceps tendon sitting within the bicipital groove. You can see this very large effusion in the bicipital sheath and also a very large subdeltoid bursa just to the right of the bicipital sheath over the greater tuberosity. Here you can see some of the pectoralis major muscle coming in. You can also appreciate some of the biceps brachii short head muscle as well. And if we were further distal, we would appreciate some of the long head muscle as well. Now we're going to look at the biceps tendon in long axis. Again, you can appreciate this very large effusion within the bicipital sheath, and this really essentially communicates with the joint. And here again, we can get a glimpse of the subdeltoid bursa. It doesn't appear so big in this view, but does have a fair amount of tenosynovitis within this bicipital sheath. Now we're going to go ahead and look at the subscapularis tendon in long axis. So here again, we can see that tendon a little bit thickened, so probably some mild to moderate tendinosis of the tendon, but the tendon itself is intact. Again, you can appreciate some of the subdeltoid bursa over the subscap tendon. And now we're going to go ahead and look at it in short axis. So again, tendinotic tendon, mild to moderate tendinosis, not much of a subdeltoid bursitis noted in this view. And also you can appreciate some of the muscle that interdigitates with the subscapularis tendon, and you don't want to mistake this for tendon tearing. Here we can see the biceps tendon going in and out of view, so we're essentially at the rotator cuff interval, and we also see a little bit of the cross-sectional view, I think, of the lesser tuberosity, in addition to a cross-sectional view of the subscapularis tendon itself. Now we're going to go ahead and look at the supraspinatus tendon. It appears to have moderate tendinosis, maybe moderate to severe tendinosis actually, in this view. There's loss of fibular ecotexture on the bursal surface of the supraspinatus tendon. And here we're just going lateral. We can see this very large overhanging subdeltoid bursitis. It's pushing up on the underbelly of the deltoid muscle. And here it actually looks like there's a septum within that subdeltoid bursa. Now we're going to go ahead and look at the supraspinatus tendon in short axis. Most of it is black from anisotropy here. You can appreciate the biceps tendon and the rotator cuff interval. And again, here you can appreciate anisotropy of the supraspinatus tendon as it abuts the biceps tendon. And here we're looking at the lateral aspect of the supraspinatus tendon, which is why it appears to be somewhat thin in cross-section. Here again, you can see this massive subdeltoid bursitis. Now we're going to go ahead and look at the infraspinatus tendon. It appears fairly normal here in this view. So you can see the infraspinatus tendon attaching to the greater tuberosity, the middle facet of the greater tuberosity. Here you start seeing some of that very large subdeltoid bursa on the underbelly of the deltoid muscle. And here we're going further laterally, and again you can appreciate this massive subdeltoid bursitis. Here's actually some motion. You can appreciate the glenohumeral articulation. You can see the infraspinatus tendon attaching to the greater tuberosity, how that essentially pulls on the greater tuberosity with external rotation. And also you can appreciate a pretty sizable effusion within the glenohumeral joint. So now the infraspinatus tendon is surrounded both on the articular and bursal surface with fluid. Here again, let's go back to our MRIs. You can appreciate coronal MRIs with severe glenohumeral osteoarthritis. And here we can appreciate this very large subdeltoid bursitis. Here we're looking at the subscapularis tendon, how it's kind of isolated from all this fluid surrounding it. And here's the biceps tendon kind of being isolated again from all that fluid surrounding it. Here's the back of the shoulder. You can see the infraspinatus tendon and the teres minor tendons coming across. Here's an axial MRI. Again, you can see the infraspinatus tendon posteriorly, subscapularis tendon anteriorly, the biceps tendon within the bicipital groove. And also a very large effusion within the glenohumeral joint itself, which is why these tendons are being essentially isolated, where the infraspinatus tendon is kind of floating as well as the subscapularis tendon. Here's a sagittal view where you can look at these tendons coming into play, where the subscapularis is to the left, as you can use the coracoid process as your guide, and you know that is anterior. Notice how the tendons again are surrounded by fluid, which is why they seem to be floating and essentially isolated from this very large glenohumeral joint effusion, as well as from this very large subdeltoid bursitis. Here we're going further lateral. You can see how the tendons are beginning to converge. And here it looks like we're looking at the anterior and posterior bands of the inferior glenohumeral ligament appearing as these fibrous bands at the bottom of the joint. And here we're going even further lateral towards the greater tuberosity, where you can appreciate subchondral cysts and tendinosis, particularly of the supraspinatus tendon, where you lose some of that low signal within the distal tendon as you see it inserting on the greater tuberosity. And again, you can appreciate a very large subdeltoid bursitis. And again, just to orientate ourselves, we can see the subscapularis tendon inserting towards the lesser tuberosity, as well as the supraspinatus tendon with significant tendinosis. And you can also make out the infraspinatus tendon as well as the teres minor tendon. Here we're going to go over this case of an extremely large subdeltoid bursitis. Here we're just looking at normal anatomy of the deltoid muscle with pectoralis major muscle. You can appreciate the biceps and brachialis musculature. Now we're moving the deltoid and pectoralis major muscles. You can appreciate the pectoralis minor muscle in a normal appearing subdeltoid bursa. Here we're making this subdeltoid bursa quite large, which is what we saw in this patient. And you can see how far it overhangs the greater tuberosity and goes distally down the humeral shaft. Here we're just giving another look at this bursa from a bird's eye perspective. You can see how it essentially abuts under the acromion and even the distal clavicle. Now we're going to go ahead and make the bursa translucent. You can see the underlying rotator cuff. You can see the supraspinatus and infraspinatus tendons. You can also appreciate the transverse humeral ligament as well as the bicipital tendon sheath. And now we just removed the rotator cuff. You can appreciate the shoulder capsule, and over that you have the glenohumeral ligaments. You can see the middle glenohumeral ligament quite clearly here. And now we're enlarging the capsule. Here we're making a enlarged subscapularis recess, and here is the capsule enlarged from a posterior perspective. You can see the rotator cuff cable as well, and now we're bringing back the normal size of the capsule, and now we're enlarging it again. And here we're just making the tendons fit around the capsule again. They are extra-articular, so when you have this distended capsule, the tendons get pushed outwards, which is why on MRI they have this floating appearance, since they are surrounded by fluid, both from an intra-articular perspective and an extra-articular perspective, as they're surrounded both on the bursal and articular surface with fluid. And here while we're rotating now laterally and anteriorly, and now we're making the subscapularis tendon thickened, consistent with tendinosis, and as well as being pushed out anteriorly from the large effusion within the glenohumeral joint. Here we're going to go over coronal cross sections of this case. Here you can see this very large subdeltoid bursa. We're going from an anterior to posterior direction. You can see how thick this bursa is, and essentially it's fluid filled. It does appear to be somewhat solid here, but again it is a fluid filled cavity. You can see the subscapularis tendon inserting on the lesser tuberosity. You can also appreciate the capsule of the shoulder joint, and now we're going further posteriorly. Again, you can see the articular surface of the humeral head as well as the labrum. You can appreciate the supraspinatus tendon attaching on the greater tuberosity. You can also appreciate coracoid process as well as the acromion. Again, you can appreciate the glenoid. Now we're going further posteriorly, and we're starting to just see essentially the supraspinatus muscle, the infraspinatus muscle, as well as the teres minor muscle and tendon as they insert on the greater tuberosity. And you don't see any part of the humerus here, as that is already cut away, but you could appreciate some of the supraspinous fossa as well as the acromion. Here we're going to go through now axial cuts of this patient. Here again you can appreciate this very large subdeltoid bursa. Now we're going from a caudal to cephalad direction. We're going through the surgical neck of the humerus and now actually into the humeral head itself. Here you can appreciate the subscapularis muscle and tendon as it inserts on the lesser tuberosity. You can also appreciate the infraspinatus and teres minor muscles. And here we're going further cephalad. We can start seeing the supraspinatus muscle. You can also appreciate some of the labrum as well. And you can appreciate the articular surface of the humeral head. And here we're going further cephalad. Again, you can appreciate supraspinatus muscle, the articular cartilage of the humeral head. And here we're going further where we're essentially left with the supraspinatus muscle, subdeltoid bursa, and the acromioclavicular joint. And now we're going to look at this from a sagittal perspective. Here we're cutting through the subdeltoid bursa from a lateral to medial direction. And here we're starting to see some of the rotator cuff. You can see the supraspinatus, infraspinatus, teres minor tendons. You can also appreciate the acromioclavicular joint. And now we're going further medial. You can again see the subdeltoid bursa over primarily the supraspinatus and infraspinatus tendons, a little bit over the subscapularis tendon, which correlates well with her ultrasound. And now we're going further medially, and we can start seeing the musculature of the rotator cuff, and you can see the labrum. We're seeing just a glimpse of the edge of the humeral head, and now we're going further medial beyond the articulation into the bony part of the scapula, and you can see the rotator cuff musculature.